For more on this, let's talk to the Vice President, Medical Initiative for Africa, Dr. Agbor Ebuta, who is joining us via Zoom. Thank you so much for joining us on TVC News at 1.
Thank you. Thank you for having me. Good afternoon, Nigerians.
Right. First and foremost, talk to us about the significance of marking this World AIDS Day. What does it seek to achieve?
Well, since 1988, when the idea was first mooted and adopted, that's 34 years. 34 years now. World AIDS Day has been consistently commemorated on the 1st of December. It's a day where there is a global, international, national, sub-regional, and local efforts are mobilized to increase awareness, deepen knowledge, and address emerging challenges in the fight against HIV/AIDS pandemic. So it means that every year, a term is picked up that it reflects the major existing challenge to address the most in terms of problems, what would be considered as priority. So for this year, 2022, what was seen to be a major challenge was against the context that while there are 38.4 million people globally estimated to have HIV/AIDS, and like in the case of Nigeria, 1.9 million, which is 5% of the global burden. And when you go deeper, you look at the number of people in percentage of people who are aware of their status in Nigeria being put at 90% and 98% being on treatment and 95% being on treatment and getting what you call viral suppression and therefore being unable to transmit to their partners. It means that there's a small percentage that is there that is left for us to drive. And that small percentage is responsible for our inability to close up and end this pandemic. Now, that small percentage, based on research, has been blamed on the lack of equality, the presence of inequality. And the people who are affected by this inequality in terms of access to preventive services, to treatment services, to support and care, are a small group of people, but they are significant because this group of people, without clear intervention and addressing their challenges, we will not meet 100%. This group of people are mainly young people under 15 years, young women who are also exposed to gender-based violence, and then people who belong to what we call key populations, people in the prison, people in the IDP camps, because, I mean, there are people, their rights and their human rights are basically being trampled upon, and they do not have the full access to resources. In addition to all of this, there are also other key population groups. But it is also important to know that within this context, you have the social, economic, you have stigma-driven, culturally driven indices that kind of all together combined for this population. As far as we do not intervene to address this issue, we would have issues with meeting the 100% target. And that's why this year's World AIDS Day is being commemorated.
Yeah, well, it does appear that
equalizing access to prevention and treatment.
It does appear that a lot of odds are stuck against, achieving the goal in fighting HIV and AIDS. But then we have only 8 years left before 2030, where the 2030 goal of ending AIDS as a global health threat. So where exactly are we in ending this goal, in achieving this result?
Well, in achieving this result, when it comes to the precise value that we are looking at, when it's about only 9% of the Nigerian population are aware of their HIV status, and it should be 100 by 2030. Only 98% of those who are getting treatment, and of those who are getting treatment, only 95% have achieved viral suppression. So we definitely have done quite when we look at the numbers, but there's still a lot to do because that small number can prevent us and can drive the pandemic. That's why there's currently efforts to look at various indices for intervention. We need to look at our human resource capacity. We need to train more people, health workers who will be available, support staff who will be available, who have the knowledge and who can disseminate it in a culturally appropriate manner to the patients and the clients. In addition to that, we need to increase the number of points of testing. The Honorable Minister of Health has said that we have about 6,000 or so thereabouts. So our target is
Well, absolutely, absolutely. Well, Vice President, Medical Initiative for Africa, Dr. Agbor Ebuta, thank you so much for your time and your insight into this issue.